Hello guys, sorry I did not get to vlog earlier. It's been a busy day. I wasn't feeling well again early in the morning, about 3 a.m. was coughing out blood again. And so, and I've been also having a lot of chest tightness and hard time breathing on and off. So I'm thinking that, maybe whatever is going on, maybe we need a different antibiotic or a different treatment plan. But I had spoken to the doctor and we are going to be admitting me into the hospital pretty much when a bed opens up. So I'll be waiting here tomorrow about that. And for those of you who don't know, May 1st starts Cystic Fibrosis Awareness Month. So all month long we try and raise awareness for cystic fibrosis. And for those of you who don't know, cystic fibrosis is a genetic lung disease which affects many organs, impacting mostly the lungs, pancreas, causing the body to produce abnormal thick and sticky mucus, which clogs the lungs, leading to lung infections, as I have going on right now. And it leads to needing IV antibiotics, steroids, hospitalizations, many different things. And most of the time, a lot of patients unfortunately wind up needing transplants in the end in order to survive. So it's different for each patient depending on their case and their severity, but that's just a little bit of general information. Just a few facts about cystic fibrosis awareness. As you guys know, obviously, there is no cure. There's about 30,000 Americans living with the disease, and which is kind of cool now that as years go on, that 50% of those people are now adults, whereas it used to be pretty much the children were mostly the higher percentage of the population with CF living with CF. So that is a pretty cool fact that has obviously came about due to all the raising awareness and raising funds and having new drugs come out and research and all of that. And then pretty much there's 70,000 worldwide people living with the disease. And as I mentioned to you guys, there's no cure. So we are going to continue to do our best to spread awareness about the disease. So that is one reason why we pretty much started doing these vlogs, to give everybody an insight into what goes on in a day living with cystic fibrosis. And I know we only show about anywhere between 5 to 10, 15 minutes at most of our day, which still doesn't fully get you guys to see exactly what we go through because we don't show everything. It would be impossible. But it is just to give you guys an idea. And I want to thank you guys for watching and joining our journey. And hopefully you guys can be part of CF standing for Cure Found one day. So thank you. Hey guys, good morning. It is Tuesday and it has been a busy morning. Of course, you guys know I'm doing IV antibiotics. Right now I have some saline going through my port to keep me hydrated, and I haven't been feeling 100%, still feeling short of breath majority of the time, having chest tightness, breathing on and off, some hemoptysis. And so just finished doing some nebulizers and I'm going to be doing my chest PT. And I'm going to show you guys a little sponge device thing that I like to use while my port is accessed to do my chest PT. That makes it a little more comfortable so that the needle isn't directly getting hit and shaken around by the vest. And so pretty much today I'm just going to be waiting to be admitted into the hospital as soon as a bed opens up. So I'm going to be packing some of my things that I have to take with me, my suitcase. Wish I was packing for vacation, but we're packing for the hospital. So I'll be doing that, and until then I'll just be running my IVs, doing my medications, and that's really about it. So I'll see you guys in a little bit. Hey guys, so here is the sponge that I was telling you guys about. It kind of is just this Tempur-Pedic looking thing that has a hole cut out in it, and the port needle sits there so that way the vest isn't pushing against the needle and causing any friction and pushing into it harder and making it more painful. So with this, I'm able to get a good chest PT with my vest and not be in any pain. And my IV saline gets to run as we do the vest. I just grabbed my last 2 nebulizers, so I'm gonna do that, and I've been doing a bunch of stuff for the fundraiser that we have coming up benefiting the Cystic Fibrosis Foundation Greater New York chapter, and I'm trying to get that all done. That way when I do get the call that the bed is open for the hospital, at least most of that stuff will be done. So hopefully when I get out, I'll be prepared and I won't have to leave a lot for my family to do, so. Hi guys, we are finally on the way to the hospital. We're stopping quick to grab something to eat in the car. And everything is all packed. I got all my stuff back there. I don't know if you can see, but
it's in the trunk most
most of it's in the trunk, yeah. So we could grab a little something to eat now, eat in the car, and then when we get there, we'll be there. So see you later. Guys, Rosario just ran into McDonald's. I know it's not the best choice. I haven't had McDonald's truthfully in about 2 months, which is kind of a long time for me. But I have been having, and I'm going to enjoy a little McDonald's before we get to the hospital, and then I have that hospital food, which last few times I've been there, it hasn't been terrible, but I would prefer McDonald's over the hospital food. So he's grabbing us some food, and then we should be there in about 40 minutes. It is pill time in the car, just taking a few of my digestive enzymes. That way I can digest that fatty McDonald's. Yep. He got the McDonald's.
I got the fish sandwich, so it's a little bit better than other stuff. No fries for me. I am down 6.2 pounds within 2 weeks. Or I think like a week and a half.
I'm proud of him, and he's doing good. And that's without exercise, because we haven't been to the gym with me not feeling well. And so in this bag I got 2 cheeseburgers and a large fries. And we'll see how far I get. But I'm looking forward to it. Like I told you guys, it's been like at least a couple of months since we've had McDonald's. So.
Yep, we've been eating better, I think.
Today's one cheat day, and then, like I said, I'll have that delicious hospital food. We are on our way. It's nice and dark. We should be there in about 20 minutes. We got doing a lot of road work tonight. Right, we are going over the George Washington Bridge, and we should be there in a couple of minutes. See you when we get there. Well, we are here. We have arrived. I'm not too excited, but it is what it is, and I have to go in, so see you later.
Hey guys, as you already know, we're in the room, and figured you guys haven't seen me all day, so I wanted to make a quick little appearance. And I'm gonna be spending the night tonight, and I'll leave at around 5 a.m. to head to work. And I'm either gonna cozy up next to Jill here, or I don't know if you guys can see that, but there's another bed, so shh, maybe I can steal that bed for the night. So last time I did that, I got in trouble and they kicked me off. They told me I couldn't stay there, I was a hazard. But I'm gonna give it another shot because I'm tired. See you guys later.
I am ready for bed, and I think Rosario is too.
Yes, I got my bed here. I got permission. I could use the bed until 4:30 a.m.
The PA gave him permission.
My wife is over there.
Then that'll be my...
We're hospital bed buddies.
Yep. So I'm gonna go test my sugar. They should be bringing in my pills and IVs in a little bit. And I think I'm gonna go to sleep because my head is pounding.
Me too.
So, good night.
Good night.